Hey, good evening, everyone. I see new faces. If you are not familiar with us, the organization is called She is Lotus. We are the only nonprofit in St. Vincent and the Grenadines that focuses on endometriosis, adenomyosis, and PCOS. Today, we have the wonderful Katie Boyce here to speak for us today about medical research and how to identify good research, um, and all the things, all the things. Oh, and our president has just joined. Thank you, Odelia, our wonderful president who runs She is Lotus. Katie is a board certified patient advocate, consulting chemist with a bachelor's in biochemistry. She dedicates her social media efforts to empowering and educating individuals impacted by endometriosis, breaking down myths, complex scientific topics, up-to-date research, and controversies within the endometriosis community. She regularly consults with key opinion leaders, researchers, and surgeons in the field of endometriosis to ensure the patient's perspective is present. Thank you, Katie.
Hi, thank you. All right. Can you hear me okay?
Yes.
All right, perfect. I got called into work last minute, so I am hot spotting it because I am in the middle of nowhere, Texas. But I think my internet is gonna come through. So everyone, thank you for joining us this evening. Of course, when I was asked if I wanted to do this talk, I said yes. It's one of my favorite things to discuss. And I just recently shared on my Instagram stories an article that was published about um, basically integrity in scientific research. And it was titled, why can't we reproduce all of these studies? And when it comes to scientific research, medical research, reproducibility is one of the key, I guess, ways of proving, right, that it is reliable information. If it can't be reproduced, then there's clearly a big flaw. So I want to kind of just take a step back though, and just kind of start with the basics of, what is, I think everyone in here for the most part is, well aware of scientific research, medical research, and so I don't really want to bore anybody too much. Um, but I do want to just start with, let me double check everybody here. Yeah. Yeah, I don't want to bore anybody. Um, pardon me. Okay. So, and I think everyone here also knows that I have done my own research in the past as well. So that's kind of where I got my initial interest in scientific research. I spent a lot of time in school doing research, and I had a wonderful advisor who taught me really how to thoroughly dig through literature. And he was really big about, pointing out to me that there's always going to be somebody who knows more, and that it's incredibly important in science and medicine to keep an open mind when it comes to that, because I think one of the greatest challenges we face is when we get too arrogant in our discoveries, and unwilling to change or look at new evidence or kind of think outside the box. So I think when it comes to the key components of research, we've got the structure, meaning like how the publication is put together. We've got the abstract, introduction, method, results, discussion, conclusion. For me, I always highlight the importance of the methodology. Unfortunately, this is harder for individuals that don't have a background in research, because it's really a lot easier to just read the abstract and then maybe a bit of the conclusion. But the methodology is really where the meat of the research is, and that is how you can really find out if it's going to be something that you can put much weight into or not. Because a lot of the times you can just look at the methodology and see right away whether or not it's going to be kind of sketchy or not. So I think first and foremost, I always talk about, let's look at the type of study it is. Meaning, are we doing just like a bench study with in vitro? Meaning layman term, that's typically what you always hear is called like the petri dish research, right? So testing on cells, tissue, it's outside of a living organism. It's very rarely translatable to real life. So that's immediately you see something that's in vitro. It's like, okay, don't put a lot of stock into this. Then we've got our animal models. Talk about that a lot in the endometriosis world because they're always using mouse models. And while mouse models can work for a lot of different diseases and other realms of medical research for endometriosis, it's not really applicable. So if we're looking at endometriosis research in particular, a mouse model is typically a red flag. And that's, I'll go into that some more in the further into the methodology. But it is, of course, more biologically complex than just using a petri dish. And then, of course, we've got human trials. And they're going to go through different phases, 1, 2, 3, 4. We've got other like subcategories to look for within those clinical trials for reliability. And whether or not we should put a lot of stock into that also, primarily when it comes to the size of the trial. So, at first you can see if it's a study that says it looked at like 30 people, right? That's obviously going to have a lot less of weight put into it than a study that's 2,000 people. And ideally, of course, we want those all to be like quadruple blinded in every way. So, meaning nobody knows what's happening. Nobody knows what's happening with each individual in the study so that we can eliminate bias. A lot of the times it'll be like open label. And of course, that means there's really no hidden whatsoever. They know which individual is taking which drug. The person in the trial knows what drug they're taking. So you open up so many, like a huge can of worms for placebo effect at that point. And then of course bias. Um, so that's why it's always really important. Everyone always talks about, randomized, controlled, double blind, but that doesn't, even then, that doesn't make it, foolproof. There's still a lot of issues that can occur at that point. But overall, you can take a look at a paper and say, okay, well, here's one that's in vitro research done on something. Even if it's endometriosis lesion, even if they're studying just the tissue, it's still not going to be the same as studying that tissue within the human body. But it could be fair to say that potentially, doing research on that tissue that's been placed in a mouse maybe has a little bit more merit only because it's been put into the mouse, but which is a more complex biological system. But even then, right, we know with endometriosis and any disease, you really need to have it in the original host to get the full spectrum of what could be going on with that disease or with that research. So for when it comes to digging into that methodology a little bit more, you also have to take a look at, a human trial, you've got selection biases. That's a huge one. So whenever we're looking at a study that'll say the certain outcomes, what's fascinating about that a lot of the time with like endometriosis, you have to look at who they even chose to go within the trial to begin with. So it'll be like, I've seen it. It came up with a friend and I were discussing earlier about potential pregnancy complications, preeclampsia, and the study that we looked at two different studies. One was saying it's not a risk. One was saying that it is a risk, but it boiled down to who are the individuals that they were choosing to be in the trial. So when you dig into that part, it makes a lot more sense. And so it's really important to take the time to look at that part of a paper when you're reading through it. So, because any abstract or title can say one thing, but you really have to dig into the methodology. So, the sample size is a big one, but then you have to really dig into the demographics of those individuals all the way down to what's a big one? Sometimes depending on like if they're researching a drug, um, you have to look at were individuals on, say, a birth control pill and how long were they on that pill or off that pill before starting a new medication, because being on birth control can impact the way that you potentially metabolize something. So it's really important to go into all of those details. Another issue that is really important to discuss when it comes to looking at research is after looking at the surface part of the methodology, is then digging into the analysis and the statistical analysis of what that data was that they got. So unfortunately, when it comes to this part of the process, there are ways to kind of finagle the numbers to make it look better than they are, right? And so this is another issue that really comes to light, especially lately, as more and more of these papers are just like flooding flooding journals all over the place, that it's like, how are these individuals publishing as much as they are? Well, a lot of the times it's a lot of really poorly done research. I think there's a lot of AI being utilized inappropriately. It does have its place. Um, so one of the most common things that you'll see when you look at the statistical analysis part of a study, you'll see a p-value. So that is kind of, a low p-value. You're going to start, I don't want to bore anybody, but that's what you're typically looking for, depending on the method of statistical analysis they used, to see if, okay, that's reliable, meaning the data wasn't too far all over the place. There wasn't a huge variation. Unfortunately, there's something called p-hacking. So that is where they can do multiple tests or only specific tests to achieve a certain statistical significance. That's a thing. Um, Often they will cherry pick their own data. So that's why it's important to be able to look at the raw data yourself when you're looking at a publication, because it's they often will leave out, they won't even address some of the data, I guess in hopes that people don't look at the fact that they had collected X amount of data, or this certain group of information, but they never utilized that when it came to applying it to the statistical analysis. So it's just another way for them to be able to say, well, I don't, that happened, but we're just gonna kind of like put it off to the side and not really um involve it. So there's another big issue with misleading graphs and figures. I've worked on this a few times, where I take the raw data and I'll make my own like graphs, right? I'll just be simple, put it into Excel and do the graphs myself. And I will notice that they have changed either the X or the Y axis on the graph to make it look better than it really is. So it's really interesting that that's one way that it can happen. And so, sure, we can look at a nice picture, but being able to actually put the data in yourself and look at the difference is pretty astounding. Another thing that has been a big issue is pretty much just completely modifying images. So taking images of the results of a test and they're modifying it. So on Retraction Watch, which is a website I'll show later, there are individuals there that will actually go through and they will scan images and they'll find duplicates, or they'll find ways that the basically been modified. Think of somebody like photoshopping. So that's a serious issue that makes it important for us to recognize that just because they're showing something on a graph or a picture, unfortunately, that should be able to be, something that's analytical, and we should be able to trust that. But now it's really important to understand that those can be fabricated. Another thing um, is, I'm trying to think of what else has been done lately with some of that. I'll go into that a little bit with some of the medical stuff. And then a big one is looking at, when it comes to conflicts of interest. So looking one of the most simple things that you can do when looking at any kind of publication is just looking at the authors, and then even if they don't state what their conflicts of interest are, they should at the bottom. They should have disclosures, who else they work for, who they're associated with, who could be paying them. Not all countries require that. So depending on where they're publishing and in what journal, sometimes those won't be there. Sometimes they'll completely omit one in one journal, and then a month later they'll have another publication where you'll see a huge disclosure, really important conflict of interest listed in another one. So one of the best things to do is just real simple. Google the authors and just look into, what is their overall presence like in whatever community they're in. So if it's endometriosis, right, just you can look them up. You can see, which organizations are they associated with, Are they consulting with different pharmaceutical companies? What are they doing in their professional life that could potentially cause a conflict of interest in their research, right? Are they working really, really hard on making a name for themselves in a certain, with, I guess you could say, like a certain theory? So you could say, so there's individuals that are really big on pushing, so like a non-invasive diagnosis. We all want that, very needed. But certain individuals have found, a way in with maybe a biotech company, and they're going to start publishing things that are biased towards promoting that and proving that that is an effective tool. Um, but a lot of the time fudging the data. So I made a reel on Instagram about one of the blood tests that was pretty heavily, that was done. It's done with a lot of kind of fudging with the stats, but just kind of looking into it and saying, okay, well, here's some red flags. It doesn't invalidate all of the research, but it's just really, really important, especially before like sharing or resharing information or anything that could be potentially sensationalized. That's another really big one, because that happens a lot in the endometriosis community. So real quick, I kind of just wanted to go over um a Canva, some slides I had made for a post that I shared quite a while ago, but it's pretty content heavy, I feel like, so people don't really want to engage in that. And I don't blame them. Um, it's not as exciting. So let me see here. Oh, look, I can do, okay, perfect. Okay. So this is the one that I made. Move me around here. Okay. Basically, this is specifically for clinical trials for endometriosis medications, as there's always something in the news, I feel like at least once a year, right? So like right now we're seeing the one with the one in the UK, the new medication that came out. It's the same thing that came out in Australia last year, and it's been in the United States for quite a while. It's Myfembree. But in general, can we trust what we're being told when we're looking at these trials, these clinical trials? So this is not just basic research. This is actually going into the trials for medications for endometriosis. So these are different ways that pharmaceutical companies can influence trial outcomes. They can impact the design, like I discussed. They can really manipulate who they're choosing to be within the trial, and that can obviously determine the outcome. How they analyze the data, publication bias, right? So who are the authors that are working on behalf of those pharmaceutical companies, and then the funding to the doctors and the research hospitals. So the impact on the trial design. So when companies financially sponsor the trial, they get to design how it's done. So they get to choose the participants. So that means they can perfectly curate the group if they would like. That way they already kind of know ahead of time, okay, this is probably going to be a group that's going to respond well. Let's include this, this type of person. And so then we know that we're probably going to get the result that we want. They can choose what they're going to compare against. So obviously, usually a placebo, but sometimes they can choose a known, like a weaker or less tolerable alternative to make the drug look better than it is. So for an example with that is, I think they probably tried that with Orilissa, but what's funny is that pretty much it has never been shown it's not more effective, right, than just taking continuous birth control. But that gets overlooked a lot, even though that isn't in the trial. And then of course they can choose their endpoints. So this is a really, really big one. Sometimes what they'll do is maybe a trial was designed to go for one length of time, but they determined that, oh, but within 6 months of using it, they had really good results, but those results kind of like faded after those 6 months. So they could choose to focus on those 6 months where there was a really good outcome rather than looking at the long term. So this is something that's really common when we look at the GnRH analogs like the Orilissa and the Luprons. If you look at the shorter term, it doesn't look as bad like when it comes to bone loss. Um, or so it can show like a significant decrease in bone loss pretty quick, and then it will show that okay, within a certain time it does go up. But if you look at the long-term trend, a lot of people, they don't continue to go up. They'll just kind of try to extrapolate and say, well, you see, after this amount of time their bone density did increase again. But if you look at it the long term, it may never go back to normal. So they kind of manipulate it in that way. When it comes to the data analysis, this is a really, really tricky way they do it. This is what I was talking about with like the p hacking, the cherry picking. So they can take a step back. Like I was saying, they have all of this data, but then they take what they want and they can find a way to manipulate it with certain statistical analysis methods to really make it look way better than it might actually be. So they are, rather than just being honest about this is what happens when we apply these different tests, this one shows that it doesn't, the data is not that great. They can just omit that and focus on the ones that really do make the data look good. So that's omitting, they're not lying, but they're just omitting important information. So of course, this is the bias that I was discussing earlier. This happens a lot, and how with the sensationalism that we see in the endo community. So we always see these like really new exciting headlines, new blood test or new medication or just something, right? There's always something. And that's what I was talking about, to make sure that you at least Google the authors, like really look into the people who are behind it before, we get excited and share it, just because it can actually, sometimes it really is harmful. Sometimes it's really promoting the wrong people. And I feel like it's just part of, at least myself as a scientist, I know that it's critical that I only share information in an ethical way. And for me, it's not ethical to be sharing information for somebody who may not have the endometriosis community's best interest at heart. And that's really common, especially right now in biotech, because a lot of the people that are trying to come up with these apps or a lot of the non-invasive tests, they're not individuals that have been around much in the endometriosis community, which is fine. We definitely always need new researchers and scientists, but a lot of them aren't necessarily, they're not researchers and scientists. A lot of them are just people who've realized that this is a cash cow. So the first person to come up with that non-invasive diagnosis is going to be the one on, like, I hate saying it, like gravy train. So there's a big push for that right now. But they never seem to look at any of their competitors' work, because if they did, they would realize that all of the data is very poor. The research is redundant and it doesn't work. But it's interesting to see how they're all, just really determined to be that one. There is one that does have better results than the others. It's kind of exciting. It is, of all things, it's the saliva test. I believe that's out of France. Someone correct me if I'm wrong. Yes, I believe it's French. I don't know. I've discussed it quite a bit in the past, but that one is actually fascinating. It does have really good, interesting data, so we'll see how that one plays out. And then of course, funding is potentially the greatest factor that influences. So everyone's, you'll see doctors now say, kickbacks are illegal. We don't get paid for prescribing medications or this and that. But the thing is that, yes, that's illegal, but it doesn't stop, their funding and their payments. So, pretty much a big one is consulting fees. So I know I don't have that one first, but consulting companies are paying the doctors for their advice. They're paying doctors to speak on behalf of them at conferences. Or, like I have up there, sorry. Doctors also getting just paid in general for their time and knowledge. So of course, this is when you get them not just consulting, but actually, helping with the trial design and analyzing the data and writing the research for the publication. So it's really important to look at when especially if it's for a drug, look at, those lead authors, especially those first few names that you see there, and look at their history and look at their relationships with different companies. Um, the research grants is huge. So you'll see a lot of endometriosis research, for example, coming out of maybe one specific hospital or research institution that looks really good. It's like, oh, that's really cool. That's a really well-known hospital. or research institution that must be really great work. But a lot of the times it's just people that have been there for a very long time. They've developed relationships there. And there's the saying in academia when it comes to research that grants get grants. So once you've already gotten a grant for your research, so say somebody at an institution that's respected has been doing endometriosis research since the 1990s, and they've gotten grants for that already, you'll see that those same people are continuing to get grants and they're not updating their research. They're just extrapolating or continuing on from their previous research because that's what got the grant. So they're not moving into, it's not like they're making discoveries and saying, oh, well, this is what we need to research next. It's more like we've discovered something new related to the research that we did, based predicated on older, outdated information now, but we're going to stick with that because that's what got us the money. So there's no incentive there for anything novel or innovative. I can only fault, you really can't fault individuals either because that's their livelihood, right? So that if they're doing what's working, they're going to continue with that. We can't just expect everybody to say, you know, thinking outside of the box and try something new. That's why I'm always talking about we need new blood in endometriosis. It's always the same people in academia getting the same money for pretty much the same research. So it's really important to look at some of the names, not because they might be consulting for a pharmaceutical company or trying to develop a blood test, but maybe because they are so entrenched in their research from the 1990s that it's hindering progress because they're the ones getting the money. They're the ones that are getting the focus, because of the relationships they've developed and basically their status within their community. So they are the ones that continue to get the money, not because they've got exceptional new groundbreaking work. It's because they've just proven to be consistent with those studies. They've just been consistent for bringing in maybe other benefits for their institution. So it's a really important thing to think about when looking at research. And this was basically me just like putting it all together here. So making sure that we're just really looking at everything through a really critical lens. And that doesn't mean like a bad thing. It just means critically analyzing and thinking about. Another thing I wanted to show here is this article that I had shared the other day. This is, where'd it go? Oh, that's why. Well, I will just not have that one up here then. That was the one that was talking about um the lack of reproducibility that is being seen more and more with publications. Let me see here. I do have it. Mm, cool. All right. So it's really good. This is a pharmacologist and he has a book coming out about this. So um what I thought was, like he said here, so biomedical scientist, yeah, there you are, around the world are publishing about 100 or 1 million new papers a year. But a staggering amount of those can't be replicated. So as we were talking about with those studies, it's really important for science to be able to be replicated. Otherwise, if you can't replicate it, then obviously, right, something funky happened there. So what's really interesting are some of the ways that he looked at this data. So he said that, um, sorry about that, about 90% of it's not reproducible from what they were looking at, which is really, really staggering. And about 20 to 30% of it is totally just made up. And if you look at the Retraction Watch website, you'll see a lot of that. It's That's crazy, right? 20 to 30% of the research out there is just like legitimately just made up. And I can show so much of that even in just the endometriosis world. I will read papers that come out and it's like this is not on any basis at all. And what's really concerning is that there's supposed to be the peer review process, and that has really become a significant complication in all of this. It's like, where have the ethics gone in all of this? It's really concerning. With endometriosis, one of the journals now, there's a co-editor, chief editor, and it's interesting to see, since they've become editor, what type of papers are getting published. And a lot of them are just chock full of very poor information. A lot of them, um, the data is astoundingly, like, the methodology from which they're getting that data is incredibly elementary. Really makes you wonder how this is being allowed to be published. And then if you look at the authors, you see that the conflict of interest is actually a very close relationship with the editors, and that's not that should be put aside. And each journal kind of has their own way of managing that, but it's clearly an issue that we see changing. Um, so, and like I was talking about earlier, with all of the different components too, the funding, the individuals, that's what I like what they say here. This is an ecosystem. So he's saying, you need to reform the education, the granting process, the publication process, everything. And I like that what he says here, that he's proposing that there should be separate training tracks for scientific discovery and scientific integrity, because like I'm saying, it's almost like, where has the ethical part of all of this gone? It's just so focused now on, I gotta publish at any cost. I have to get my name out there. And with that happening, so much good work is going to the wayside. We don't even see it anymore. Um, and this is also interesting that, what this individual is proposing here from the granting side. Um, for the most part, right now, we work in a system where each scientist is viewed as a solo artist, and they submit individual grants to get funding, like I was saying. So you've got this one institution, but you've got somebody doing their endometriosis research there since the 1990s, but they continue to get the funding. It's not necessarily like, it's not the hospital or just the research facility getting that money. It's this individual has gotten grants, and they're going to continue to get the grants. So this is saying here, um, one way to maybe change that up a little bit, why not instead give each institution a lump sum of money for research and attach reproducibility and replication in scientific integrity to those funds? I think that would actually be a wonderful way to get around some of the current issues that we're facing. So then we can point out, hey, at this institution, this data is not good. It's a bad look for your institution. And pointing that out, then the institution at that point could choose elsewhere, where to put those funds, rather than a panel of people saying, oh yeah, we like this person, we like the work they've done in the past, they get all this money. And I do like they also say here that a benefit of this approach is that there's less time spent on writing grants. A lot of people spend they spend a lot of time, instead of doing research, they've got to spend a significant amount of time trying to get the money. And it's so hard to get that money, that's another reason why it's like, once you do and you can hold on to it, you're gonna want to do that, rather than risk going into some new theory or really something groundbreaking, especially with endometriosis, because it's difficult if you've already secured money before and you're going to keep securing it. So, um, I think that, if anybody wants to look this up, you can just type in that title and it'll go there. Why is that nobody can reproduce anybody else's findings? Serious issue. And then, of course, here's a retraction watch. If nobody has seen this yet, it's really great to I kind of peruse it every couple days just to see, different things that are occurring, that are being found, like this paper by a dean and a medical student retracted for mislabeled ECG. So that's just an example, of one of those ways that you can look at a graph or a chart, but they're completely, modifying it in some capacity. This is another one that's interesting. Why do nearly 45,000 scholarly papers cite themselves? I see that a lot with endometriosis. There was a piece not that long ago I shared where it was a guy that was basically just an opinion piece, but he considers himself such an authority in endometriosis world that he considered it more than an opinion piece, and it was presented as something more than an opinion piece, and it was primarily just citing himself. So that's clearly an issue, right? That's not very reliable. I also see papers are citing retracted papers. So say you make a publication 5 years ago, but within those 5 years, something you cited got retracted. That becomes an issue, right? So then that's kind of like a cascade effect. But also I've seen publications publish after something's been retracted and it stays there. Why was that not caught on peer review? That's a serious issue. I've seen that with a Lupron paper that has been cited like 100 times and it's been retracted. So that's another thing to look at. You have to look at all of the sources, and that takes a lot of time. Um, so here's another example. I was talking about the image manipulation, the basically photoshopping. So here's an example of that happening as well. So it goes on and on. So Retraction Watch, I think, is a really, really, really good page to kind of investigate a little bit just to see, it's really eye-opening, just how easily what was once considered, the pinnacle of proof for scientific evidence has now become not really. And in a lot of ways, it can seem maybe discouraging, but I really look at it as an opportunity for everybody, not just scientists or not just those doing academic research. It's an opportunity now for everybody to look at research and say, all right, well, does it make sense? It's to the point now where anybody with any bit of common sense can just take a look at this and say, does this make sense? Does this add up? You don't have to be somebody with all this specialized training at this point. Sometimes maybe with the methodology, but even now, like with ChatGPT, it is so easy. I encourage people to do this. Take a paper, copy the methodology, the statistical analysis, whatever, put it in the ChatGPT and ask it, what are the potential flaws with the methodology of this trial? What are the potential errors or manipulations that could have been done with the statistical analysis? Ask those questions, and it's astounding what even ChatGPT can give you the answers for. So it really now it's a great way for academic research and publications to no longer be like gatekept from the general public. And even if it responds with like terminology or technical terms that are just kind of confusing, just ask it. Just say, okay, thank you. Can you reward this in layman's terms? And then it will go through it. And it's really wonderful because it's just really important now with all of the fraud and the issues that we're facing in academic research and even industry with clinical trials. I think it's really important to take a look at all that information, and it doesn't need to be just reserved for people who have this formal education in it. It's helpful, but in a lot of ways, it's not 100% and always necessary. So, especially with a lot of the people that we see trying to sell programs in the endometriosis community, they're always trying to say that some herb or supplement did this or did that, and they'll cherry pick and they'll put a couple of their sources so it looks legitimate. They'll be like, okay, here's the PubMed ID. I used a real source, but again, here we go. In that recent study, there, who knows, maybe that one's got its own issues, but that one says 20 to 30% of those publications had just straight up made up information, which we see. So at that, it's important to know this information so we're not getting scammed. But again, it's not all bad. I think it's actually really important that this is coming to light because I think it's important that a lot of these individuals that have never been touched before, like they live in this ivory tower of their research that's never been questioned, and they've just kind of gotten away with whatever they want. The light is now being put on them, and they're being held to a higher standard. And I think it's actually really good in a lot of ways. So it's not all doom and gloom. And I think that it's good for general public to have this knowledge and realize, okay, I'm not intelligent enough to read through this information. I can understand this. And maybe if it's too complicated, you can ask something like ChatGPT. It's not perfect, but it's a starting place. And I value my education and the amount of time I've spent doing research so very much. And the least I feel like I can do is try to share some of that because I don't feel like it should be kept behind paywalls, and it shouldn't be kept behind an attitude of, well, you're not smart enough to read this. That really irks me. I feel like everybody is capable of learning and understanding any of this information. So I see that's all I've got with that. Um, thank you. Thank you, Heather, for the France. Okay. Don't know if anybody, I don't know. Anybody have any questions?
Yeah, usually we like to have some time for questions at the end. Oh, thank you, Heather. Thank you for coming. Um, so yeah, we do want to take some time for questions. I have some questions that were sent to us. Let's start with how can patients and caregivers become more engaged in understanding medical research related to their conditions?
Really great question. I think one of the best ways is to utilize one of the search engines, the common search engines for looking up research or publications. So a lot of people use PubMed. You can go to Google Scholar. I like Google Scholar for a few reasons. There's usually a link if it's open access. If it's not open access, you can use something called Sci-Hub. So you just Google Sci-Hub. I'm putting it in the chat, and it gives you like a few different weird looking links. You can put the title of the publication there, or when you look at the page where the paper is, where it'll have a DOI, it'll have like an HTTPS address and DOI. You can copy that and put it into that Sci-Hub search engine, and it will pull up if there is a free copy. So I think that's really important. Yep, really important for individuals who are trying to do research on their condition and they keep hitting this wall, right? It's like, I can't read any of this because it's behind a paywall. That's a really good way to do it. And then also, if brand new to this, I used to have websites that I thought were really great resources for learning how to do it. But now with ChatGPT, you can honestly ask it, say, can you make me a template or an outline for how to get started with reading medical literature? And that'll help a lot.
Awesome, thank you. Um, one of these questions you kind of went over, like it says, what are some of the common red flags in medical studies that should make someone skeptical about their findings? I think you really went over that, but it did mention a little bit about p-values. Can you expound a little bit more about exactly what a p-value is for those who don't know?
Yeah. So I was gonna pull something up on here. I used to have a website that worked really well for explaining the different types of statistical analysis, but I didn't have that pulled up. I should have. So let's see here. Is my screen still sharing or not? I thought it was.
You were, and then
It went away.
yeah.
Oh, weird. Okay. Well, I was gonna show, okay. So p-values are that is, it depends on how like knowledgeable somebody is in doing like statistical analysis. So there's different statistical tests you can do. Like there's a really common one called like a student's t-test. And that is where you take all of the data that you have, and you remember doing like mean, median, and mode in elementary school. It's basically that. So you're looking at it and you're saying, okay, here's the data we got, and you pull it all together, and you can do, you can get like the mean, the median, and depending on how all over the place it is or how not all over the place it is, you get what's called a p-value. And that p-value is the measure for saying, sorry, my laptop's trying to die, how reliable that information is. Unfortunately, it's going to change a little bit depending on the type of test you do, but usually what it means is you have a hypothesis and you're saying, okay, if they take this medication, this is going to happen. If you put all that data together, the result of what happened with everybody in like that clinical trial, and the p-value is small, then it's saying that your data is probably reaffirming what your initial hypothesis was. And I know that's like a lot of ugh, annoying language, but that's why they call statistics sadistics. It's kind of a horrible thing. Um, but if that p-value is large, that means there's a huge variation in what was happening there. So it's really important. So say, let me put this in like an easier context. So say you're just looking at a study and it's got the list of p-values. You can look at those p-values, and if it's, greater than, they're usually small numbers, like 0.05. If it's 0.05 next to an outcome, okay, with the data, that's reliable information. But again, you got to look at the people that were chosen for it. But if you see a value, it's like a P and the value is less than or greater than 1, like that means I would not put any merit whatsoever into that data type of thing. I don't know if that was helpful at all.
Yeah, I that makes a lot of sense. Um, I have another question that's coming in. They're still typing, but I have one here that says, for someone who likes to research these conditions to learn more and understand what is happening to them, how do we deal with situations and approach conversations with doctors or medical findings when discussing research findings, particularly if they may not be open to the findings you have come upon?
That's such an amazing question. A whole hour could be spent on that. I love that
Right.
question so
Like
much.
essentially, like how do you bring your research to your doctor and then combat them, calling you like, oh, Dr. Google or one of those.
Yeah. Well, this is right
I've
up
definitely had that happen to me.
this is right up your alley, and this is right up Heather's alley. Also, two other board certified patient advocates. This is what we do, right? So I think when it comes to, every doctor is going to be different, right? They're human beings. Some are going to be much more open-minded to you investigating your condition or your disease than others. When it comes to, so let's just stick to endometriosis. Say, a doctor wants you to go on a medication, like say they're like, well, you should just take Lupron or Orlissa, it's going to be great. It's the newest best for endometriosis, whatever. But you say, well, I'm kind of concerned about that because I did my research, right? As soon as you say I did
Mhm.
my research, their, hairs on the back of their neck are going to go up. But what's really the best way to combat that is, if it's a medication, always go to the FDA's website and look up. You can just even Google the drug name FDA approval packet, and you can look at the prescribing information. And a lot of the times, what's pretty astounding is the doctors haven't even looked through a lot of this information. And all you have to do is, most of the time, that information is going to be in there already. So say you're like, I don't think I want to take this because I'm not sure my bone density will come back once I quit. And if a doctor says, no, that's not true at all, it comes back, the actual prescribing data itself shows that no, it may not.
Mhm.
So the doctor, that is the strongest bit of evidence you can provide, is the actual FDA prescribing data for a medication. They can't argue that. And if they do, then that's a serious issue. They should be reported. The issue is that they're not reading that information. They're just being told something and they're just following it. AKA, they look at guidelines, they don't dig into it, they prescribe. So, first and foremost, always, always, always refer to the medication label. Talk to a pharmacist if you need to, and go through that information. And then you have that with you. It's available to anybody for free online. You can say, well, actually, the actual FDA approval for it says this. That is the strongest you can give. Otherwise, a decent way of approaching it is saying, you know, um, I've been reading through a lot of literature. If you say literature, it's just it's just using words that are going to make you sound a little bit more reputable to the doctor. It shouldn't be that way. You should be able to say, I've been doing my own research. everyone should be able to, but unfortunately that's associated with like a bad connotation now. So say, I've been looking through different bits of literature. These are some of the conclusions that I have found on this subject. Is this something that we can talk about a little bit? And they should respect that. If they don't, and depending on the situation somebody's in, they say find a different doctor or whatever, but that may not always be the case. But um, it really boils down to their personality at that point.
That makes a lot of sense. That makes a lot of sense. Um, I'm reading. Okay. So it's a very important question. It's a very important question. I'm unsure of how, well, let's see what you say. So a lot of endometriosis research is based on non-Hispanic white women, and this data is not very representative. I know in my own personal researching, looking for literature, look, it's sparse, sparse at best. What can we do to help make this data more representative? Because cultural access to resources, etc., are important factors. For example, we don't even really know what the prevalence of endometriosis in Caribbean women are and what our needs are. What can we do to facilitate this process?
I really wish there was more for the patient community to do for this because unfortunately a lot of this is going to lie on um pharmaceutical companies. And actually when it comes to medication, that's one thing. But I think for general academic research, I think as a community we can continue to apply pressure. And it's hard because it's like, how do you apply that pressure? I think it's not calling out because call out culture is kind of becoming not so great anymore, but recognizing and pointing, showing and sharing, hey, yeah, this is a cool publication that came out, but, I'm not represented in here, right? So, and I'm not just me. There's a lot of me, So in saying we're not represented in this paper, so these might be interesting findings, but it would be better if we could be more inclusive and get data on more individuals, different types of individuals. And by doing that, I think again, it's that conversation that has to start and then eventually hopefully can trickle into, academia, trickling into the communities, maybe the social circles of those that are doing the research as they realize that, oh, they're noticing this, right? It's awareness. We're recognizing this now. So I think awareness might be the first thing that we do. Continue to talk about that. And it has gotten better in general, right? We see like, oh, women need to be more like represented more, but it's astoundingly bad when it comes to any kind of looking at variety of ethnicities in particular, right? It's just astoundingly bad. So I think, maybe first off, starting with the awareness and really, I think by us being sharing that information, expressing that we notice it and sharing that it is important to us, I'm hoping that in doing that, it becomes more recognized by those individuals doing research. Um, when it comes to pharmaceutical companies, only thing I can think of is if you're in a situation where maybe you go to a doctor and they present a research study, maybe those doctors that are presenting it to you, they are relatively important individuals in those studies. That's some feedback you could say, well, I would participate in this, but this doesn't align with certain values of mine. And I noticed that, culturally, this doesn't, align with me. And I noticed that because of that, you're probably going to miss a large demographic of individuals in this trial. Just kind of giving that feedback when and where we can. It is a really great question. It's a significant issue. And I really do, I wish, I'm always about like taking action, and it's hard when there's not an easy action that can be taken. But I think talking about it more in the community, and it being discussed by the voices that have the platforms, right? So like I'm always, if anybody ever wants to talk about that with me or have something they want me to share regarding that.
Oh, oh, I think her internet got cut out. Hopefully, we'll wait a couple minutes and hopefully she can rejoin. Oh, our lovely president would like to say something. Would you like to come off of mute?
Yes. Um, Good night, everyone. Um, as I was listening to the question and the answer, wait, excuse me, I need my glasses, I can't see. As I was listening to both the question and the answer, I'm sitting here as a Caribbean woman and just thinking back to all of the research that okay, Katie's back.
Oh, okay, let me go in.
To all of the research that I have been reading since I've been diagnosed. And I follow Heather, and every article that she posts, I run digitally to go read. Because she always has these really great articles to share. And I don't often see myself represented in the articles. So I love what Katie had to say about when we're in spaces where we can advocate for ourselves, to encourage more research to be done in our communities, that we do so. But something Julia and I have been talking about, Julia from the Barbados Association of Endo and PCOS have been talking about, is doing what we can in our communities with the resources that we have. So whatever research that we can do to see how best we can get it published. A lot of times funding opportunities are not available to us in the Caribbean, and that is a big barrier to research being done. So for example, working on something about the mental health experiences of women with endometriosis in the English-speaking Caribbean. And I found 3 articles on that in Caribbean Women. 1, 2, 3. And I'm like, you can't write a paper on 3 articles, girl. What are you gonna do? And I'm like, but it's so needed. Where do I go from here? And talking to Julia this week, she said, nothing for us without us. So as women with endo in the Caribbean, we can do some research, as limited as it is. It's a way to get our foot in the door. It might spark greater interest, funding opportunities, or quote unquote bigger researchers to jump on board with us to make it a bigger thing. So I think, advocating for ourselves, doing what we can with what we have until we can get more funding, greater partnerships and collaborations to get the research needed. And as I see Heather here, Heather, thank you for the inspiration to read more research, because I would always want to get the Cliff Notes version. And you inspired me to actually read the articles myself. Read from the abstract to the reference section. And that has really helped me in my journey in understanding endo for myself and being able to explain it to others. So when I see all of the new marketing gimmicks about this wonderful new drug, as it was saying earlier, like the one that was coming out this week, or this wonderful new drug, and everybody's sending it to me because Delia, this is gonna be help for you. And you have to explain to them,
No.
no, this drug has been around a while. It's just rebranded and marketed again. It's nothing new. So without that inspiration from Heather, I wouldn't know this. So I thank you for that, Heather. And I'm so happy to see you here tonight. Anyway, I'm gone again.
Heather also commented in the chat, says the need to not only increase the diversity of the studies themselves, but the diversity of the researchers conducting the studies, they need to be amplified and funded. So
I
yes,
agree.
absolutely, 100%. Katie, do you want to, you did get cut off before. Do you want to like kind of finish what you were saying, or do you even remember?
Sorry. Sorry. No, I was just finishing it with, if there's ever a time, that I can use my platform to help anybody when it comes to representation or focusing or bringing awareness to the lack of representation in research, always send it to me, send it my way. I'll do whatever I can, however small or whatever it is. But I feel like it's really important. If for no other reason, from a science perspective, how are we going to understand what's really going on if we don't have a good look at the whole spectrum? To me, it's like fundamentally that easy. So there's that. All right, that's all I've got. But thank you so much for hosting me tonight. I really appreciate it. Thank you everybody for sitting through a lot of that technical information. It really does mean a lot to me that anybody would ever want to hear me talk. So I really do appreciate it. So thank you for having me. Thank you everybody who sat through this entire hour. I really, really appreciate it.
It was amazing, and we really, really appreciate you. We did get the live stream going. It missed like the very beginning, but most of it is available on Facebook, and I do have the full recording, which will go up on YouTube at a later date. I'm seeing a lot of messages coming in from the Instagram from our friends in Australia who are interested in rewatching this talk. So thank you, thank you, thank you for just blessing us with your knowledge this evening. We really, really appreciate it. And thank you to everyone who has joined us both here and on Facebook. And if you're watching this later on and you need any of the links, you have any questions for us, please. Katie is at Endo Girls blog. We have she.is.lotus on Instagram. I'm at Tanty and thank you all again. Have a great evening.
Good night. Thank
Bye.
you.
Night, everyone.